Hello everyone, I'm Dr. Aparna. I'm heading the Department of Neonatology at KIMS Cuddles, NICU. And today we are going to discuss about a very important aspect of the care of newborns, about newborn screening. Newborn screening is a process by which normal newborns are screened for potentially life-threatening conditions, because early screening and prompt diagnosis can help us to intervene or treat these newborns early and save them from life-threatening complications. Newborn screening includes screening for some metabolic genetic conditions, screening for critical congenital heart diseases, and screening for hearing problems. The answer is no. Newborn screening panels are custom made based on the incidence of the common genetic metabolic conditions that are more prevalent in a certain population. For example, if we know that a certain genetic disorder, for example, condition which affects the red blood cells of the body called sickle cell anemia, if it's more prevalent in a certain belt of population or in a certain race, then that is mandatorily included in the newborn screening panel of that population. Likewise, if there is some other genetic disease like cystic fibrosis, which is more prevalent in a certain population, then it may be included in the screening panel of that particular population. So, newborn screening panels are essentially custom made based on the prevalence or incidence of the common genetic metabolic conditions. Newborn screening primarily includes three major categories of tests. 1. Metabolic screening of newborns for some common conditions, which is done based on blood test, what is called as newborn metabolic screening. This is usually done for common hormonal problems like congenital hypothyroidism, adrenal hyperplasia, and a few genetic disorders which involve deficiency of critical enzymes which are required for the metabolism or breakdown of proteins, carbohydrates, and fat which is present in the milk. These include conditions called as inborn errors of metabolism, such as organic acidemias, amino acidopathies, urea cycle disorders, fatty acid oxidation disorders, etc. The second broad group of newborn screening is newborn hearing screening. We perform universal hearing screening for our babies here at KIMS Cuddles. This is performed by one of two different types of tests. One is called as OAE or otoacoustic emissions, and the other test is called as BERA, which is brainstem evoked response audiometry. Both these tests work on different principles, and they are essentially used to assess whether the newborn's capacity to hear is normal. This is very essential because we know that early diagnosis of hearing problems is absolutely essential for intervention and for the normal development of language. The third category of tests included in newborn screening is the pulse oximetry screening, which is done for detecting critical congenital heart defects. This test is done by connecting the newborn baby's right hand and either foot to a pulse oximeter monitor to assess the oxygen saturation levels. Based on the results obtained, it is possible for us to detect whether the newborn baby has absolutely normal heart or whether there is a suspicion of the baby having a critical birth heart defect. These are the three major types of screening tests which are included under newborn screening. The first test, the newborn metabolic screening, is performed by taking a few drops of heel prick blood on a filter paper. Usually 4 to 5 drops of blood would be sufficient. This is processed for assessing the levels of various analytes or various chemicals in the blood, which give us clues whether these are normal or whether these are indicative of any of the metabolic disorders that we discussed. Usually these tests are performed after completion of 48 hours of life, and the results are generally available by 24 to 48 hours. The second test is the hearing test, which is OAE or BERA. Both these tests are not painful, they are not invasive. They are performed by either placing small plugs which are placed into the baby's external ear as done in OAE, or by placing what we know as a BERA phone over the baby's scalp. Based on the electrical recordings that are obtained, one can assess whether it is absolutely normal. In case it is suspicious, then the baby may be referred for more detailed evaluation of hearing. The third test, which is the pulse oximetry screening for congenital heart defects, is generally performed after the baby crosses at least 24 hours of birth or just before discharge, whichever is later. This test is performed by connecting the pulse oximeter probe to the baby's right hand or either foot, and based on the saturation records that are obtained, it is classified as normal or suspicious. Newborn screening is, as the name implies, a screening tool, a tool to pick up as many suspicious cases as possible so that we do not miss a single child who has a potential life-threatening problem. But these are not specific tests. So, if there is an abnormal test obtained on the screening, be it the newborn metabolic screening or hearing screening or pulse oximetry screening, it is still not confirmative of the defect in question. The confirmation always requires performance of more detailed evaluation, which may include the levels of different enzymes or reassessment of these metabolites or getting a more conventional hearing test. So, always get back to your pediatrician or your primary doctor with the reports of these tests, and if these are suspicious, your doctor will advise you about the further course of events, whether the baby requires a more detailed assessment or whether the baby requires treatment straight away. In case of an abnormal newborn metabolic screening, there are confirmatory tests such as assessing the levels of enzymes or getting genetic molecular tests done. If the hearing screening tests are abnormal, then we usually advise what we call as conventional BERA, which is the more confirmatory test for assessing hearing. And in case the pulse oximetry screening for heart disease is suspicious, then we get a detailed 2D echocardiography for looking at the structural aspects of the baby's heart. And these are the confirmatory tests. So, a newborn screening when abnormal is not confirmative of the disorder. The purpose of this video is to raise the awareness about the importance of all types of newborn screening, be it metabolic screening, be it hearing screening or pulse oximetry screening. It is the right of every newborn to have a proper screening done, because every baby deserves the right for an early diagnosis, prompt referral and early intervention, which is not only life-saving but also can prevent major morbidities. Thank you.